Hello and welcome to Health Matters on Channels Television. Thanks for staying with us. I am Mary Alale Yusuf. The number of confirmed COVID-19 cases is almost 600,000 globally, according to Johns Hopkins website. About 131,000 of them have recovered, and there have been over 27,000 deaths worldwide. The number of deaths in both Italy and Spain have eclipsed China's figures at over 9,000 in Italy and over 5,000 in Spain. The United States of America has the highest number of confirmed cases so far, more than 104,000 of them. In Nigeria, cases have climbed up from 1 about 4 weeks ago to 81 as at the 27th of March. Most of the cases are still imported ones, but there is some evidence of local transmission. My guest today is a public health physician, public health consultant, and a member of the Association of Public Health Physicians of Nigeria, Dr. Chidumga Ohazurike. You're welcome to the show.
Thank you, Mary, for having me.
Okay, so now we have 81 confirmed cases. And the NCDC is now saying for social distancing, we want 2 meters, no more 1 meter. That's about 6.5 feet. So what more can this extra distance achieve?
I would want us to even understand the term of what social distancing means. So in practice, what it means is physical distancing.
Physical distancing,
so
WHO
there has
says
to be a distance, some distance between you and the next person. So 1 meter, 2 meters, but the further apart one person is from another person, the better it is. So if you can achieve 2 meters, so when you use the word at least, that means a minimum.
Yes.
But it can be as far apart as it can get, or you can get between you and the other person.
And this helps how?
I think Nigeria is lucky because we have a lot of lessons to learn from people who have responded to COVID-19. Africa is behind China, behind Italy, behind Spain in the number of cases. And presently, New York is the epicenter of COVID-19 in the US. Slowly is moving to New Orleans as of this morning. But they've seen that social distancing worked, even in Wuhan. So you won't put a distance between you and the next person. Why? Because this is an infection that is a droplet infection. And a droplet infection, when you cough or sneeze or even talking, you release some droplets of spit that may fall onto the next person. So if you are so close to that person, this droplet can fall onto your hand or onto your skin, and then mistakenly, if it falls to your hand or falls on your face, then you now rub it into the mucous membranes of the nose, of the eyes, of the mouth, and then you can easily get infected. We're advocating for these things because this virus is highly transmissible. So it has a high, what we call a high reproductive potential. One person can at least infect 3 other people.
In a space of how long?
Just by that contact, but just by having that contact. So
okay.
You have contact with one person, and a droplet from one person gets to that person. So if people continue to mix, you meet like minimum 8 to 10 people a day.
That's right.
So if you're meeting 8 to 10 people a day and you're infecting 3 people, you go out the next day, infect another 3 people, you can find out that one person can end up infecting like 30 people in 1 week. So that is why we need to limit physical distance between one person and another person.
Okay, some places have gone on full lockdown. Some people live with other people. So what will this lockdown achieve?
For Nigeria, it's going to be difficult because there's what we call social determinants of health. There are other things that determine the health status of a people. Housing standards.
Yes.
So you tell someone to self-isolate, and the person lives in a room with 7 other people. Mm-hmm. He doesn't have his own convenience. How is that even going to happen? He lives in a place where you have a central kitchen. So for us to begin to achieve things in the strong way that we want it to, there's some things that needs to be in place. But unfortunately, those things are not even in place. So housing standards will be a major challenge when you tell someone who doesn't have what we call healthy housing and public health to even begin to achieve these things. And that is why the government is on all burners trying to make this thing not to become a community, not for us not to have local spread or community spread, because if we get there, it's going to be much more harder, because of the economic indices of Nigerians, so to speak.
But do you foresee a lockdown in Nigeria?
I think what the government has been doing is to partially scale down things. I don't know how a total lockdown is going to work out in a country like Nigeria, where 70% of people are daily income earners. But this is a disease that also requires a lot of social solidarity. If we have to get there for us to save ourselves, we can't afford to become another Lombardy having 700 to 900 deaths a day. That's unimaginable, even for people's mental health. We don't want to get there. So what I think the social solidarity on our part is whatever we can do to stem the tide of this thing and get it over and done with. I think everybody's hands should be on deck to do that.
That brings me to the next point. The WHO has been harping on take responsibility, telling all citizens take responsibility. Let's just take a scenario of somebody who is coughing, but he feels, oh, this is my regular cough that I have once in a while. What does he do about taking responsibility?
I think taking responsibility is for everyone. Everyone at this moment, everyone, whether you sell in the market, you work in an office, you're a comedian, whoever you are, you're a politician, you're a very important person, you're a healthcare worker, everybody should be taking responsibility in their space. And what taking responsibility means is different for every person. So let me take, like, you're a business and you are in the essential business that needs to continue to run even in these times. So is there a way you can rearrange your business to maybe have less number of workers coming in per shift to still give the services that you're giving? Can you arrange,
or at least skeletal services, because sometimes it's just not possible to give everything.
Or can you arrange the services that you give out to people? Let's say you're a food court. So instead of people coming into your counter to ask for food, can you make it a drive-through, or get someone who will get those orders close to the door and come to the counter, get the food, and so that you limit, so you have 1 or 2 workers interacting with people instead of having like 5 people on your counter and they are all interacting with customers. Then if you're selling in the market, what are you doing? Do you have water close to you where you can regularly wash your hands? Just get a bowl of water and soap that you can wash your hands intermittently while you continue to sell your vegetables or your tomatoes that you do. Can you arrange your goods in such a way that you can maintain some distance between the person who is buying from you and you who is selling? So we need to work around these things. If you are sick, there are channels at this times for you to get health care. Now, do you understand? Even if you feel sick, because I think the issue with COVID-19 is that it has similarities with very common illnesses. Nigeria is still endemic for tuberculosis, and people will still cough with tuberculosis. But at least healthcare workers have a high level of index of suspicion for COVID-19. And so there are questions if you present yourself to any healthcare facility, aside from falling into the categories of those people who NCDC have designated as being suspect cases, like if you're a returning traveler or you're a close friend of such a person, you're a contact of a returning traveler. If you're not in that category, but you have symptoms of cough, which anybody can have, if you present to a healthcare facility and tell them the truth, because there are also stories about people who are returning travelers who've gone to access care in private healthcare facilities who did not give their travel history. So we need taking responsibility.
Every other person.
Taking responsibility also means giving, if you find yourself in the presence of a healthcare worker, giving the true story of where you have been in the last 2 weeks. That will help to protect that healthcare facility. It will help to protect that healthcare worker. And it will put you on track for you to access the healthcare that you need as fast as possible. So those are the ways we can. Then if you're a returning traveler, the advisory is for you to self-isolate. So if you don't adhere to that instruction, that means you're not taking responsibility and you're putting all of us at risk. anybody. You can put, if you enter a mall to buy whatever from the mall, you're going to put the people selling at the mall at risk. If you have people working in your home who are your domestic staff, you're putting them at risk. So I think people should take the advisory seriously and really self-isolate if you belong in that category of people who need to self-isolate. All of us, even as individuals, my personal taking responsibility at a personal level will mean washing my hands as regularly as I can, not touching my face or my mouth, my nose,
and
staying
staying 2 meters away from
staying
people.
2 meters in, and staying home. This COVID-19 has one pill and one pill alone. People are asking for treatment. The treatment
but
is
you can
home.
stay at home. Your essential services.
Yeah. So people who don't need to be at work or who don't even have any business walking around the road should please stay home.
So let's say there's somebody who needs help with high blood pressure.
Yeah.
He doesn't have COVID-19. He's not coughing.
Yes.
I know that we're not on full lockdown, so maybe he can go to the hospital, right?
Yes.
Does he have to choose the closest hospital just so that he doesn't enter a bus? Or can he call?
I think what physicians are trying to do is to give their patients appointments, so their physicians and hospitals are calling their patients, re-strategizing on how they'll keep in touch with their patients even in the midst of what is happening. So if you're a regular patient at a particular clinic, I'm sure that clinic or that hospital is communicating with you on how you continue to receive care even at this point. But if you have to get anywhere, if you have to seek treatment that is unrelated to COVID-19 and you need to get there, just make sure that you have your hand sanitizer close by you so that for every touch on the bus, you sanitize your hands, please.
Okay, let's talk about somebody who is on self-isolation. Somebody comes into the country from some high endemic country and is responsible enough to self-isolate. What does his family do? How should they treat such a person? Where should they restrict such a person from going to? How do they take responsibility to make sure that infection doesn't get to them or doesn't go out the door?
Okay, so the NCDC has a self-isolation guide that is on their website. Some of the things in that guide suggest you put the person in a room with its own convenience, a toilet and a bathroom. If you can't afford that, then the person should have breaks that the person uses the convenience and quickly flushes. Again, it takes us back to housing standards.
But you have to clean down that whole place.
At least disinfect with chlorine, which is in our household bleach.
Okay.
Do you understand? Disinfect with chlorine, which is in our household bleach. But the NCDC self-isolation guidance has rules. And then if someone has to bring food, the person doesn't need to enter that room to bring food to you. Just leave it at the door, and then you, as a person who is self-isolated, And then they have the guidance is so good that it also gives room for what you can do to maintain your mental hygiene.
Okay.
Because it's not even easy to tell someone to just be in a place. Sometimes
There's talk about the mental health now.
So sometimes it feels as if you're
cabin fever.
Yes. So there are things the guidance say you can listen to music, read books, meditate. So these are things that you can do to keep your mental status high up there while you go through self-isolation. So I think anybody going through self-isolation should get that guide and then read it very well and try to do the things in that guide.
Okay, so let's now talk about, because they keep saying that they don't want community transmission. There's those that are imported, those that are local, and there's community transmission. We'll come back after the break and talk about that. Please stay with us. We'll come back right after the break and continue. Welcome back. This is Health Matters. We're talking about surviving COVID-19. If you have questions for the program, the number to call is 0805-468-3514. That's 0805-468-3514. You can also tweet your questions at CTV_Mary A while we continue with the program. So the government is talking about opening food banks to help maybe the more vulnerable, the poorer people, those who have handicaps. if eventually there's a lockdown or something more than what we're doing now. Do you think, would it be out of place for communities, people in communities, to also do some of this work for people who are in isolation in their communities, to help keep themselves safe, keep those people safe, and prevent things from going out to other communities? What do you think?
I think, as we've talked about taking responsibilities, all of us have to take responsibility for ourselves and for each other. So if you're a community-based organization, if you're a faith-based organization, and you can recognize people around you, or even if you're an individual and you know that this my neighbor may not have enough to survive a lockdown of 2 weeks, you can go out of your way and just check in on your neighbor. Social distancing doesn't mean you shouldn't check up on others.
So in checking up on your neighbor, who you don't know whether is positive or is negative, you still have to maintain your social distancing. Yes. Maybe I want to take some rice, beans to my neighbor. What is the procedure? What do? I just put it at the door, maybe knock and leave. I'm talking about this social distancing.
Yes, I want
How far are we taking it?
I want to believe that you have your neighbor's phone number.
Okay.
But if you don't, you can knock and then step away. So you just knock on the door, and then the person opens the door, and then you just give your... I'm sure that I want to believe everybody understands what is happening. So I'm stepping away doesn't mean that I think you have it. It's just keeping both of us safe. Because for us to survive COVID-19, we have to believe that everyone has it. So that's the mentality. Just believe that everyone
But then some people do have it and don't know.
Yes.
Asymptomatic carriers. So it makes sense to assume yes. that your neighbor might be a danger to you, or that you might be a danger to your neighbor.
Yes.
So,
yes. So when you wait, so you knock and the person opens the door and give you a distance and say, neighbor, please, this is all a hard time for all of us, but I think that this can help you at this time. Do you understand?
Let's quickly take a call. Hello?
Hello, good afternoon, madam. Hello?
I can't hear the person. Can you speak a bit louder? Okay, we'll have to try again. Please do try again. It might come through. So that was just to understand how serious this might be. The person shouldn't feel offended.
Yes.
You might have it. I might have it. So we're just trying to stay safe.
Yes.
Because there are records of asymptomatic transmission. Right?
Yes. Yes.
Good. Now, we hear that these asymptomatic people, how much of a danger can this be? Let's say there's social distancing. Are we going to be able to escape asymptomatic transmission with this?
I think what we should understand that asymptomatic carriers can be anybody. It
Yes.
can be me. It can be you. It can be anybody. But what even makes this virus more virulent, as we say it in public health, is its high transmissibility.
Yes.
So someone who is asymptomatic can still transmit the virus. But if the person is away from other people, at least you limit the number of people that person can transmit the virus to.
Okay, so because of this, all the things that people are hearing about this virus, and they're not just sure what next is coming, what's the new information about this virus. Every day we're hearing something new. It's a droplet. Tomorrow it's airborne. The next day asymptomatic transmitters. So I see people going around, they're wearing masks. And some people wear the same mask all day. Who should wear a mask? How? And for how long?
I think that's a very important question. Who should wear a mask? If you are coughing or sneezing, or if you're looking after an ill person, or if you're a healthcare worker working in treatment centers, those are the people who should wear. Or if you're also a healthcare worker who is doing what we call aerosolized procedures. So you're working in the eyes, you're working in the nose, you're working in the throat. Those are aerosolized procedures that can produce aerosols.
Let's hold your thought and quickly take this call from Victor. Hello, Victor, calling from Kano. Are you there?
Yes, hello?
Hello, what's your question, Victor?
I want to know, we are told that We are told that there is no case of coronavirus in Kano yet. How can we confirm that or establish that? Can you help us from this program?
Okay, thank you, Victor. Thank you very much. That there's no case of COVID-19, how can they be sure? But let's even add to that. No case of COVID-19. Should they be taking the full measures that we are taking in Lagos now? Social distancing, staying at home and all that?
I think what has made COVID-19 to spread so fast is travel. So someone is in Lagos today, maybe in Kano tomorrow. So there is no way to stick out your neck to say there is no COVID-19 in Kano.
Okay.
It may just be an asymptomatic carrier. It may just be someone who is sick somewhere, who has not accessed the right kind of healthcare facility to even get tested. It may be someone who doesn't know, who doesn't even know the symptoms of COVID-19. So we can't stick out, no state in Nigeria at this time to stick out its neck to say there is no COVID-19. You can only say we have not tested enough to have found one person who is positive. Okay. But until that happens, I think those states who are not even having confirmed cases, as it were, as of now, should still take those same measures.
Okay. Now, let's go back to those masks. Does it mean that if you're in your office and you have observed your social distancing, you shouldn't wear a mask at your office, maybe your 9-to-5 job?
Yeah.
For those in essential services.
Yeah. So for those who have to work,
yeah,
and the person wearing the mask is not sneezing, is not coughing. If you're sneezing or coughing, then please wear your mask. But if you're not sneezing, if you're not coughing, and you're maintaining the distance between one worker and another worker, there is no, because the droplets are not, they don't fly. So that is why that distance.
That's why that distance is maintained.
So whatever happens.
But quickly, tell me about gloves. Some people wear gloves all day.
That's also very dangerous.
Should we, as regular workers, be wearing gloves at all?
We should be washing our hands. Yes,
okay.
That's what we should be doing. Wash your hands instead of wearing gloves. Because if ever you come in contact with the virus on your gloves, you put other people at risk. So you're using the same gloves and you're touching all the surfaces that may not even be cleaned. So then someone else comes and then touches that same surface. So you're putting everybody around you at risk. I think such practices should be discouraged.
Thank you very much, Dr. Ohazurike. It's been wonderful with you on the show. We've come to the end of it. Thank you, everybody at home, for listening in. Stay safe. Those are the numbers you can call if you're at home and you need any help. Have a wonderful day. I'm Mary Alale Yusuf.